better healthcare, Medicare for all. How do you feel about healthcare? What we should do? How do you feel
Yeah.
about Medicare for all?
Well,
Go on. Yeah.
the people just have to look at simple economics when thinking of anything, and that's supply and demand. So over the last, 50, 60 years, we have increased demand by putting more people on, Medicare or Medicaid, let me say. We've added more people doing that. And also with the big employer provided, that's the more that went up, the employers could write off their employees' health expenses, that what they have to pay on their employees' behalf. The more they can write that off, the more that people jump into those healthcare plans. So it's just they increased demand with government policy, but they did not increase the supply. So since the 1920s, you had the American Medical Association doing everything they can to make it harder for the next doctor to get his license. And for obvious reasons, a lot of industries do that. It's like I don't think it's very moral, but it's they protect their income producing abilities. The less supply of doctors, the more each doctor in the system is going to make. So all the hospitals and the doctors, American Medical Association, they collude together to make sure that supply doesn't go up. And then it's so hard to build a new hospital. Like if some billionaires like, hey, I want to give back. I want to help increase the supply of healthcare, available hospitals and doctors and all that. To build a new hospital, you have to go through so many hoops, and you should just be able to donate a hospital if you want to. If you got billions of dollars, build a hospital and put the money up for the doctors and all that stuff, and try to build more hospitals. That's what we should do. We should build more hospitals, more rural hospitals, just increase the supply. So that's what I would say to bring the price down. If you're going to have so many people in the healthcare system, you're going to add to the demand. You've got to increase the supply, and that goes for anything, But the thing is, you've got people who, I mean, I don't want to say they're corrupt or anything, but actively doing what they can to lobby the government to pass certain laws to make it harder to build hospitals, and make it harder to get credentials to be a doctor. We should be able to. There should be urgent care clinics being run by nurse practitioners. Way more. That should quadruple, if not be 10 times what it is now. So that at least there's you know you break your leg, or you need stitches, or you need a prescription for this or that. Like the nurse practitioner can take care of that stuff, and doctors would hate that. They would make less money if that was the case. But that's what I would do. I would use a market-based solution, um, so that uh, there's always that's the capitalist in me. There's always an incentive to work hard and get promoted and make more money, but not using the government to protect your ability to make money by just making it so there's less doctors. That goes against innovation. That goes against capitalism. That's using the government's policies to make yourself more money, and that's not capitalism. That's mercantilism. That's America's not a full. Uh,
All
yeah,
right. All right. Now, what were you? Last thing I heard was that's not capitalism.
yeah. I was saying that having an American Medical Association is a lobbyist group. Having lobbyists lobby the government to use um, policy to aid one group of people against another. So they're aiding a group that's established against a group that has not established themselves yet, and that is not capitalism. It's mercantilism, and it's what's wrong with our government. Um, so yeah, like I said, I would make making it so that making new hospitals and new urgent care centers, and who can run those urgent care facilities, like nurse practitioners, instead of having to have a doctor's license. that would significantly drop the prices of healthcare, I think. So, like I said, whatever you got to do as a government to increase the supply of healthcare to meet the demand so that prices don't keep going up and up and up. Because we have this big baby boomer generation, and when they started Social Security in the 30s or whatever, it was 7 workers to 1 retiree. Now it's 2 workers for every 1 retiree, and it's getting worse over the next 15, 20 years. So, that's a big reason why healthcare costs are going up too. Is there's a large portion of our country that's aging and needs healthcare. So you got to increase the supply. And that would be the case even if you had universal healthcare. You're still going to have prices for you got to reduce the price of doctor visits. You've got to reduce the price of surgeries of across the board. You got to, and the way you do that is to increase the supply. So it doesn't matter if everyone's on the same healthcare plan or if it's all these different healthcare plans. You still got to increase the supply. That problem's not going to go away. So, I just wouldn't do universal healthcare because I don't believe that the government runs things very well. That's correct. You look at the U.S. Postal Service, and it loses lots of money every year. And like Venezuela is a country that has like 660 state-run companies, and over 70% of them lose money every year. And that's because no one has an incentive to work hard to keep their jobs. Their jobs are just safe until the whole thing collapses, like what's going on over there. So I've studied it, what happens with socialism for many years, decades now. So I know what the dangers of collectivism are, and central planning from one big central government is planning the entire economy. That's why the United States does so well, because we have a very diverse economy where there's so many different people making money in so many different ways because they have the freedom to do that. So if you have a USSR type socialism where you test out of high school and they go, oh, you should be a chemical engineer and you should be a civil engineer and you should be this and that. It's the freedom is just not there. Whereas in the United States, you have all the freedom in the world to be a dominatrix if you want to make money that way. You can make money in any way you want, pretty much, in the United States, and it's not so much the case in a lot of socialist countries. So so that's what I'd say about. I definitely would keep the system we have, healthcare wise. I would allow anyone, even if So if it's like if there's a healthcare provider or a health insurance company in Las Vegas, if they want to cover people in Massachusetts, that should be okay. I don't know, and that's just another protect my insurers over yours. It's like that. They should be able to cross straight lines and offer insurance plans, and there should also not be one size fits all insurance plans. They should, if you have a certain pre-existing condition that you think you can manage without healthcare because it costs so much damn money, you should be able to carve that out of your healthcare plan. You should be able to make whatever healthcare plan you want to make with a health insurance provider. So, if you just want to do catastrophic, like somebody hits you and you got to take an ambulance, you break your arm or something, like that's all you care about. You're going to handle cancer and diabetes and heart, disease on your own by trying to be as healthy and eat as healthy as you can. And you think you can do that, and who's to say you can't? Right now, you can't. With Obamacare, it's very much one size fits all plans that include everything. You can't just a la carte. I'll do that and I'll do that and I'll do that, and I don't care if you don't want to cover this and this and this, or that and that and that. So, like I said, there should be more freedom in how health insurers can insure you, and there should be a ton more supply of available health care, more urgent care clinics, more hospitals, and make it easier and loosen the regulations on that kind of stuff. So I wouldn't go just a one. I would never want to do to get rid of all the private insurers. I don't think that the 150 million Americans who are on a employer-based healthcare plan will ever go for that. You know, ditch that for a universal healthcare plan, especially with the way everybody knows Americans aren't eating very well. You know, a lot of people eating fast food, a lot of people eating real bad stuff, and diabetes is one of the biggest problems. You know, heart cardiovascular problems, all that kind of stuff because of what people are eating. They're just not eating very well. So, and there's some people who probably go out of their way to eat better, and you know, those people aren't going to want to be on the same healthcare plan as somebody who's eating very badly. You know, so that's my position on all that.
Okay. So I am. I'm not going to argue necessarily in favor of Bernie Sanders' Medicare for All bill because I see a lot of flaws in it. But I am going to argue more in favor of kind of like the NHS system in the UK,
Yeah.
wherein, you know, you have, they're able to build hospitals, the government is, and also the doctors are technically employees of the state, so are the nurses, stuff like that.
Kind of like VA,
So,
right? It's
kind
like our
of,
VA.
kind of more efficient and more positive results, more well funded, unless you're talking about in recent years. But even then,
Yeah.
most people in the UK are going to vote to get rid of the NHS. But
They
no,
love it.
but
They love it.
yeah.
So yeah.
So, so I think that the problem. Well, you said earlier, the AMA, they lobby against, against people basically being
Yeah.
able to be properly insured. They're against single payer as well. So I do think that that is definitely a problem. Lobbying for certain industries is definitely a problem, but I don't believe that it should be the free market that decides how healthcare is necessarily handled. I think the free market should be taken out of the conversation. The government should fund the hospitals and everyone's care. So therefore, everyone's able to get it. You mentioned earlier about how some people they don't necessarily have very many health problems. The reason why that may be is because they are able to go see a doctor to stop certain things from being able to happen.
Mm-hmm.
But here in America, we have a system where people don't have the ability to be able to go for a doctor or go see a doctor once a year, once every 2 years to check up on themselves, to be able to have that preventative talk about how their health is going. So under a single payer system, everyone would be able to do that. So therefore, you would be able to have a healthier populace, and you would have less of those situations where you become so unhealthy, and then next thing you know, you have a heart attack, or you have A, B, and C happen, and then you have this big bill. But even if that does happen to you, where that happens, like a heart attack or something of that nature, you still have that covered under a single payer system.
Mm-hmm.
So, as we all know, people that have countries that have single payer healthcare systems, they tend to be more healthier on average than people here. They have higher life expectancies. That's the reason why, is because people are able to go to the doctor and be able to have the info, to be able to know what's going on with their bodies, to be able to stay healthy before those things happen. Um, Another thing is you mentioned the hospitals, the rural hospitals. Currently, right now, the reason why some of the hospitals, especially here in Oklahoma, have closed is because people are uninsured and aren't able to go to these hospitals in order for the money to go through to these hospitals. Under a single payer system, the hospitals would be able to stay open regardless of how many people are able to go to them or not, because the hospitals tend to be in the more urban areas where there's people, but in the rural areas where there's less people, those hospitals have closed because there's less economic development, therefore less people are going to be there, and some of those people are going to be less insured, so therefore it's a combination of both things. If the government were to fund that hospital, that these hospitals, they would just stay open, and therefore during a pandemic where we have places that are probably going to be filled up with hospital beds and whatnot. Their hospital beds are going to be filled up. We would be able to build those hospitals and add on to them, and we would also just have those hospitals there in case that a pandemic happens. Um, so that's kind of my argument with that, is that we would be a healthier society if we all just had healthcare. The freedom issue. Oh, and you also mentioned employer healthcare insurance. Many people are losing their jobs right now. What is it, like almost 10 million people have
Yep.
lost their jobs?
It's about 20 million. It's on
20
its way
million. Yeah.
to
So
30, and
you see,
it's all across the board too. It's not just in restaurants and bars and entertainment
hmm
and stuff like that. It's
yeah.
big time, and the people who were like, oh, I can just work from home. I guess now they're getting laid off. So
But yeah,
so
but like some of those people, they're losing their health care right now because they've also lost their job. Under a single payer healthcare system, they wouldn't have to lose their health care
yeah.
whenever they lose their job.
I think we
So
should. Well, the big test I think of all healthcare systems is going on as we speak. You look at Italy, and they haven't made a good case for themselves on how good their healthcare system is. I mean, the death rate over there was like 11, 12%. The UK's death rate is double digits as well, and ours is about 3% right now across the board. And I would think I know there's more tests. I mean, there's more cases probably that people have because a lot of it is asymptomatic or very mild, like 80% that they say. But it just the United States has the best healthcare system if you can access it. So that will leave a good amount of people who don't have access to it. So it's almost like like a trade off of the top 70-80% having great healthcare is for the bottom 20% to have nothing. And it's like you see that a lot in the United States where it's like 15 to 20% of the population really needs a lot of help um, getting getting helping to make ends meet and all that kind of stuff. It's like you know you're always going to have that percentage of population where you got to help them out, and that's why we have welfare and that's why we have food stamps and the things that we have. It's just I think when you have 330 million people and you border what is a third world pretty much a third world country in Mexico. My mother's side came from there, from southern Mexico in the 50s. Um, and their healthcare system is not very good. Not great. But I mean, is it a universal healthcare system in Mexico?
I believe so.
But it's just not great. Um, so people come to the United States to get stuff, but then you hear about people in the United States going into Mexico, and there's a lot of horror stories when you think about surgeries and this and that. I've heard a lot of horror stories with people going over to Mexico to get stuff done cheaper.
hmm
Um,
Yeah,
and
but
that's
you
another
talked about
another problem,
you.
with our system.
Yeah, and you talked about the issue of access. We have the best healthcare system if you're able to access it.
Yes.
Well, the access part is the money. When people don't have the money, they don't have the access. But in countries where they have a single payer system, if you don't have the money out of pocket, you still have access. So
What do
therefore, you're
you
still
think's
able
going
to
to happen
get stuff.
to so like in Beverly Hills? I lived there from like 2012 to 2015 or so,
Mhm.
and all the gastroenterologists, the ear, nose, and throat doctors, just all the specialists, they didn't even take insurance at all. I mean, I did. They would just say, I'm not going to take insurance. You just paid them straight up, and they were the most richest, doctors in the world, pretty much in Beverly Hills. And so
Mhm.
it's like when you have a universal healthcare system, the government's going to tell you did all this schooling and all this stuff, and going to tell you how much you should make. Which you know what that you might make that much if they would stop if the AMA would stop favoring current doctors over doctors who want to become doctors. You know, maybe those doctors who are making all that money would not be able to command such higher rates if there were plenty more doctors and more supply of doctors, and the government did what they could to increase that kind of those kind of doctors and all that kind of care. So, but I just think that's the thing. It's if you are a provider of healthcare, you're gonna if you do the universal healthcare system, you're gonna have to do what they say. You're gonna have
Mm-hmm.
to do what your employer, which is what would be the government, says. So it's like kind of that USSR forcing people to do this job for that much money, and
Well,
that's what a lot of people don't like about socialism is forcing people to um, you know do what the government says and the job that the government says you should do and all that kind of stuff. So that's the danger. That's what a lot of doctors that I know would be afraid of, that they wouldn't be able to set their own rates and all that kind of stuff. And even right now, a lot of doctors don't want to take Medicaid. A lot of them don't even want to take Medicare because they're reimbursed very late. And then the Medicare and Medicaid say, no, we're not going to pay any more than this for that procedure. And that doctor's like, well, you're telling me what I can, charge for my business, And so that's what a lot of Americans don't want that to happen in their industries, even if it's not has anything to do with healthcare. They wouldn't want anyone to tell them this is how you need to do it, and this is how much you're allowed to charge, and no more than that. Which is what they do in Venezuela. Like I said, 660 state-run
well,
countries or
well,
businesses.
in the UK and with the NHS, the
Yeah,
doctors they get paid monthly, so it's not like you're going to be worrying about where your money's coming from. Doctors in countries with single payer healthcare, they're not starving or anything. They're still able to live
no,
decent lives,
they're a lot
and it
smaller though.
also, but also with like some certain jobs, you do get incentives. They do get bonuses for how well they do. Like I know if amount of their some of their patients, if they quit smoking, they get a bonus for that. If they if they have a certain amount of you know things like that, they end up getting bonuses for them. So it's not like there's no incentive structure to do better, or no it's just not you being able to tell people how much they're going to have to pay for XYZ.
Yeah,
So it's more beneficial that way, because then more people will have access to what they need, as opposed to people having to have the price tag but not be able to pay for the care that they need.
yeah.
So yeah.
The thing to me is like I said, 330 million people in the United States, 60 million people in the UK. So
Yeah.
it's a lot easier to run a big healthcare system like that with 60 million versus 7 times that. Uh, you know,
We
so
also
I
have
think
more money
not
than
six and a half times that.
but we also have more money than them. Like we're the wealthiest country, so we would be able to have more money to put more resources in schooling. We'd be able to have more resources to hire people. So there would be more. We'd be able to incentivize more people to be able to become doctors and to be able to stay in that profession. And we probably, if we funded it correctly, would be able to have a better healthcare system than they do.
Have you looked into the amount of private health insurance that is offered in the UK?
The amount of it is
Hmm.
probably very little. It's probably for supplemental.
Yeah, it's supplemental for brain, like there's certain things the NHS won't cover, and that's where these private insurers come into play. So I think in the United States, if we could, there should be like a public option that is, at least the stuff where it's like if you get hit by a car, if you break your arm, the stuff that's not like uh, dependent on like the food you eat and like the lifestyle you're living and all that kind of stuff, which is contributes to diabetes and cancer and heart disease and all that kind of stuff. There's sometimes you just you just get into an accident, or you know you take a fall and you break something or whatever, and then you're like you hit with 60,000 dollar bill because you just broke your arm, and or your arm got out of its socket and they had to pop it back in, and it in the ambulance ride and the whole day cost you 50 grand, and you have to declare bankruptcy like that. That kind of stuff, I think. I think Democrats, liberals, if they're smart, they would introduce um, like a smaller or like more of a bare bones uh, government plan, and then there's the private insurance for the major stuff, or stuff that you feel like if you eat better, or if there's certain ways to prevent your cancer, and there's I'm really big into epigenetics, which is your mental state controls the amount of inflammatory responses you have in your body. So if you're angry all the time, if you're mad at the world, or if you're you know upset and you're depressed, or you're not listening to yourself and the kind of life you want to live, and you're just upset about that you're going to die sooner from that. You're going to have more adrenaline flowing through your body, more upregulation of your your sympathetic nervous system, you know, and you'll get health problems from that. So I'm big into that. Big into trying to eat as good as I can. Especially hard from the road. I tell you, you try to do the whole foods thing and eat right and everything, and then you're on tour, and it's like you got McDonald's on one side and you got Wendy's on the other side. And it's like but a lot of Americans, that's all they eat.
Yeah.
So it's like it would be when we have this big pharma. I know socialists, and liberals, progressives have to they have to hate big pharma. It's like let's sicken people with chemicals and crap food and just a ton of refined carbohydrates. Like if you walk into any supermarket, it's like high fructose corn syrup that, high fructose corn syrup this. It's a lot of crap, and that stuff puts visceral fat on people, and that releases endotoxins that attach to cholesterol, and then that cholesterol can't go back to the liver and get processed, so it sticks on the side of a wall, and then you start getting heart problems. So there's so many problems that the food industry, and with chemicals that make it so food lasts longer, all that stuff. But that severely impacts Americans' health, where Europe doesn't have as much of a problem with that, because they've passed laws and done what they needed to do to make sure that uh, those unhealthy foods aren't hurting their people. So it's crazy that the double pronged attack on Americans, which is like the horrible food and all the chemicals and all this stuff, and there's no, there's an industry that's just trying to profit off healthcare, like as high as they can. So I think as long as everyone keeps talking about it, um, I think that Americans can at least start with, hey, if you break your arm or you need some like an urgent care thing, that there should be like a Kaiser kind of thing that's run by the government, but it's just urgent care clinics. I think that stuff like that should be talked about, where there can at least be compromises between the capitalist, kind of free market approach, and then the more socialism driven, VA type approach, some kind of hybrid in the middle there, which is compromise. I mean, that's all you can do in politics is compromise. No one's ever going to get everything they want, I don't think.
All right. Well, I
All
feel
right,
like we spent a lot on that.
that was good.
Let's go into the minimum wage. So, how do you feel